Hello everybody and welcome to the Thursday edition of Video Clips, and I'm going to start with part 2 of the material I started to cover on Tuesday about drug companies and marketing ADHD to the public. And the more I look at this, the madder I get. You'll probably hear that in my voice here. Well, as I mentioned early in my talk on Tuesday, the drug companies are now targeting adults, and they're also targeting people who are not impaired, suggesting that they probably could be. Because some studies have shown in the short term that scores on tests improve when kids take ADHD drugs. Now companies are claiming that even good students can benefit from taking the drugs so they can become better ones. And of course, a lot of drugs show short-term improvement in something. It's the long term that turns into the disaster, whether we're talking about drugs for cardiovascular disease or drugs for mental health issues. Mothers are a big target for advertising campaigns, playing on the fact that all moms want their kids to do well and succeed in school. An ad for Concerta included this statement: better test scores at school, more chores done at home, independence, a smile I can always count on. I mean, this just makes me want to throw up that this is being marketed in this way. Even the medical journals cash in. The Journal of the American Academy of Child and Adolescent Psychiatry runs about 100 pages a year of ads for ADHD drugs. Of course, the side effects appear in 4-point type that nobody can read, and docs rarely pay attention to it. Another important cog in the wheel is advocacy groups that appear to be independent. An example would be the Children and Adults with Attention Deficit Hyperactivity Disorder, otherwise known as CHAD. Support from drug companies helps to fund public service ads and brochures that emphasize the need for drugs without so much emphasis on the side effects. CHAD now has 11 drug company sponsors, one of which is Shire, the company that paid the fines I talked about on Tuesday. Shire, in fact, spent $3 million just on one campaign to mail the group's magazine, which is called Attention, to doctors' offices throughout the United States. No one is exempt from the drug company's comprehensive plans, including teachers. They're encouraged to give pamphlets to parents explaining that ADHD is a disease and why medication is advisable. One states, quote, parents should be aware that these medicines do not drug or alter the brain of the child. They make the child normal. I mean, this is patently false. It is misrepresentation. However, the campaign has worked. 1 in 7 kids receives a diagnosis by the age of 17, and the new challenge for the drug companies is to keep them on the drugs when they grow up. Ty Pennington, host of The Revolution, has become a spokesperson for Shire, and a psychiatrist on a television program featuring Pennington told the public, go get this diagnosis so you can skyrocket. This is just abominable. He added that stimulant medication was effective and safer than aspirin. I just can't even believe it. In addition to giving adults who were medicated as children reasons to stay on the drugs, companies are targeting adults who have never taken the drugs. This is also working. 26 million prescriptions for adults were written in the United States in 2011. Now, who's leading the education program to teach docs about diagnosing ADHD in adults? None other than our good friend Dr. Dodson, the early champion of drugging children. He and the drug companies claim that 10% of all adults in the United States have attention deficit hyperactivity disorder and don't know it, and they imply that it's up to the doctors to identify and treat these people and help them. Online quizzes are also offered to adults, and a New York Times telephone survey of adults who took one quiz showed that almost half of them had a score indicating that they had ADHD. This is a strategy otherwise known as disease mongering. Develop a test that turns normal people into sick patients who need medication. In an even more subtle and insidious practice, drug companies imply that ADHD runs in families. While studies show that most parents with an ADHD child do not have ADHD themselves, the drug companies promote the family connection in pamphlets and online videos directed at educating doctors. One piece was headlined, "Like Parent, Like Child," and stated that ADHD is a highly heritable disease. An online education video for doctors shows a psychiatrist pointing out within 6 minutes of his beginning his interaction with the patient that he has an ADHD child and recommending that the adult try medication to solve his own problems. The ADHD issue is crucial. It has reached crucial status. 3.5 million kids are drugged in this country. It can only be solved when members of the public realize that they've been duped and harmed by the drug companies, false advertising, government policies, doctors, researchers, teachers, and others. These people and groups have collectively banded together to convince parents that their children are sick, have a disorder, the diagnosis of which is impossible to confirm, that they should take drugs which have never been proven to improve long-term outcomes and have been proven to have frightening side effects, and that they as adults may also be candidates for medication because they have this condition too. The government will never make the drug companies and medical profession admit the error of their ways. It will never make them pay for the irreparable harm that has been inflicted on such a high percentage of our population. What will hurt them the most is to dry up the demand for useless and harmful drugs and treatments and starve them out of business. For unethical people and companies who are accustomed to having unlimited funds and getting their way, this is the best way to create hell on earth for them. Now, I'm counting on you to tell others. That's all for now. As usual, pass this on to other people. You might want to relax, take a deep breath before you do. Pass it on to other people who you think would benefit from hearing it. Have a great day and a great weekend, and I will be back to you again on Tuesday.